In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. I'm Terry Bradshaw. This is Health Briefs. Advances are constantly being made to better the lives of countless individuals. Let's explore the next generation of medical technology. It is estimated that some 50 million Americans live with chronic pain resulting from diseases or physical disorders, while another 25 million suffer from lasting pain after surgery. Some 2/3 of these people have been living with this pain for over 5 years, driving extensive painkiller use and sometimes misuse. According to the Centers for Disease Control, many thousands die from overdosing on painkillers each year, almost 29,000 in 2009. About half of those deaths involve the misuse of potent painkillers available only by prescription. Much of this pain is caused by the buildup of scar tissue within the sufferer's body called adhesions. Adhesions can result from any form of trauma to the body. Accident, surgery, excessive inflammation, or repetitive stress, resulting in conditions like carpal tunnel syndrome, tendonitis, and joint pain.
The way it affected me with the surgeries going bad after my injury, I live with extreme pain, very limited range of motion. A lot of the things that I was used to doing in my normal everyday life, I couldn't do anymore. And I was almost ready to give up with anything because they were just giving me medications and they weren't working for me. Nothing was working, and I didn't really know what to do.
Now there is a better way of dealing with this pain quickly, inexpensively, and without the use of drugs.
Rapid release technology helps with this pain by introducing high-speed vibration into the body. These vibrations pass through the body, targeting brittle scar tissue, and passes harmlessly through the healthy tissue.
The Rapid Release Technology Procedure, RRT for short, is painless and can be administered by a physician's assistant, physiotherapist, or chiropractic assistant. A treatment lasting 2 to 5 minutes can offer relief from pain that lasts days or weeks. Even a few RRT treatments can sometimes eliminate the need for further surgery. The RRT treatment simply feels like a vigorous massage, relieving muscle cramps and spasms and relaxing the patient.
Rapid release therapy has profound effects on soft tissue, for it easily and comfortably breaks up scar tissue. It elicits the tonic vibration reflex, which uncouples the guarding mechanism of the agonist and the antagonist, which are the two opposing muscle groups. So that allows a quick reduction in spasm and cramping.
Using the home treatment model, a patient can even self-administer this pain-relieving therapy in the privacy of their own home. The technology could bring relief to millions of people whose days have been reduced to trying to cope with pervasive chronic pain.
Rapid Release is dedicated to democratizing healthcare, allowing patients to become more self-reliant, happier, and productive later in life at a price point that everyone can afford.
The RRT system applies rapid but light compressions to the soft tissues in the area of the pain. Healthy tissue simply vibrates along with the compressions and remains unaffected. But when the compression waves reach stiff, brittle scar tissue or adhesions, the transfer of energy softens and often dissolves the unwanted scar tissue, the source of the chronic pain.
Using rapid release therapy, patients will usually notice immediate relief in their soft tissue pain. Within 2 to 6 treatments, we usually notice a significant reduction in their soft tissue dysfunction.
In a time of skyrocketing healthcare costs, both clinical care providers and the insurance companies should welcome this low-cost alternative treatment. Other forms of scar tissue therapy can be painful, require repeated treatment by a top-tier licensed practitioner, and come with the risk of causing bruising and even more scar tissue.
After I broke my hand in my fight, I had a failed surgery the first time, just didn't go well, and the rapid release has helped me tremendously. I mean, it's really fixing my range of motion. It's making my hand feel better. The pain's gone away. I can definitely tell that it is breaking up all the scar tissue.
with providers of health insurance looking for quick, cost-effective results, as well as reducing the reimbursements offered to caregivers, the potential value of a fast, effective treatment becomes clear. The cost savings realized from enabling patients to avoid surgery and heavy drug regimens could amount to billions of dollars annually.
Rapid release is a paramount tool that I use on a day-to-day basis to help me mitigate pain that I feel from an IED blast and subsequent surgery from Iraq. And so much so, in fact, that I've incorporated into Vital Warrior, which is my nonprofit, utilized to mitigate the stress response. And the way we use it on veterans and first responders in that organization is that it reduces pain levels and subsequently their stress.
For patients, this process is quick, convenient, and yields lasting results, where further surgery might end up causing more adhesions and pain.
I sustained a pec major tear, and after surgery I started physical therapy. And initially when I came in, the area had a keloid scar elevated about 1/2 inch, and after one treatment the area was completely flat. My mobility was increased, I would say, 10 times, and I had virtually no pain, and I was able to actually sleep at night.
Rapid release has affected my life in that I had shoulder issues from surgery, and it has allowed me now to again play catch with my grandsons where I couldn't do that before. It also helps me with my sinuses, relieve the pressure behind them in just a 1 or 2 minute treatment, and I'm good to go after that.
The RRT treatment has been embraced by major professional and amateur sports organizations, including 40 pro teams and 3 U.S. Olympic teams.
Rapid release has helped me with my shoulder, gaining mobility back in both my knees and my shoulder, helping me just get less pain and helping me get back to competition faster.
For athletes, it means a quick, safe, and effective means of treating minor or chronic injuries right in the locker room, then returning to the playing field refreshed and rejuvenated.
Rapid release therapy is currently conducting or has completed studies in sports performance, industrial, and military settings, all demonstrating a reduction in the number of visits to return patients back to full duty.
From weekend warriors to professional athletes who travel a game circuit, RRT offers a quick, simple, safe, and effective way to treat their injuries while on the road, in the training room, or at home. They find it invaluable for pregame toning as well as postgame recovery.
Rapid release therapy has been a great addition to our physical therapy practice. We can treat patients with complex soft tissue dysfunctions such as IT band syndrome, lumbar and cervical spasm, rotator cuff dysfunction, all within 2 to 5 minutes, easing the stress on the therapist and keeping the patient satisfaction very high.
Rapid release has affected my practice dramatically. It's allowed me to treat conditions that I hadn't been able to treat successfully before, from the most chronic to the most acute. It is one of the most simple, easy to use, effective pieces of therapy that I have seen in 35 years of practice.
It's often surprising how powerful the effects can be from a treatment that is so subtle in its application. The RRT treatment is gentle enough to use on a lap dog, and yet effective enough to be felt by a 1,200-pound horse, so a person will find it ideal, soothing, relaxing, and pain relieving.
Well, the technology that Dr. Stanbridge invented will have a profound effect on the cost of healthcare and will significantly improve the quality of lives of millions of people. Our ultimate goal is to create a foundation for the study of high-speed vibration therapy. I think Dr. Stanbridge should be nominated for a Nobel Prize.
Within 1 year of its introduction, RRT was already in daily use by medical and veterinary centers around the world, in addition to professional and Olympic sports teams. Independent practitioners have been adding RRT to their practices as their patients quickly learn of the fast and long-lasting pain relief it offers.
Well, as far as sports and athletics, it's a given that it's going to be an advantage for anybody who wants to take advantage of it. But the main focus of rapid release technology is to help the billions of people on this planet who are suffering, who feel like they've exhausted all their options. Well, the reality is there is a solution.
Fast, safe, and effective, RRT offers pain sufferers the relief they've been looking for.